question about the, you say Alabama didn't accept the extension or go on that plan, and was it a purely financial, monetary dollars decision, or is it an attitude of people that, is there any, you got any thoughts on that, or how come we don't have a better society for our people?
I will say for the first 4 years, there certainly was not a money issue, because remember how the plan was laid out. The first 4 years, the government basically funded it 100%. Now, my opinion would have been we should have taken the deal after 4 years. If it's not working, trash the deal, because it gave you a way out. But we would have at least got the $4.5 billion that would have came into this state for the first 4 years. But I think if we had accepted it and we would have saw the economic engine that would have surrounded those $4.5 billion, we probably wouldn't be having this conversation about expansion, because we would have expanded based on the economic surroundings.
Hey, is this on?
I do want to respond to her comment. The governor has the power to expand and suggest expansion right away. The legislature does not have the power to force Medicaid expansion. And so when you look back where we were at that time, it was during the Bentley administration. And so the governor, when you look at this issue, it is really up to the governor and the executive of the state to make that particular decision.
And he very specifically said, if I recall, I'm paraphrasing, that he was not going to expand Medicaid because he didn't want to make Alabama more dependent on government help.
And he was pretty busy at the time.
He was busy with that grant. Yeah.
He was busy.
One other perception out there regarding Medicaid that I want to clear up. Medicaid is, although it's typically labeled for poor people, it's not for necessarily poor people. Yes, they may not meet a certain federal poverty level, but these are women and children and disabled. That's the majority of who's on Medicaid. There are times individuals may lose their job and they can come on Medicaid, go off of Medicaid based on their economic status at that time. But if you look at the majority of the citizens that are on Medicaid, those are women and children and disabled individuals.
Is there any assistance with all these new walk-in clinics that are coming up? Even Huntsville Hospital does some. And the other question is it like kind of against the law for the emergency room to say, hey, why don't you walk across the street and be seen? Or, I mean, is that?
Yes, that is absolutely against the law. They have this law called EMTALA, and it's the Emergency Medical Treatment Act. And what that act states is anyone who walks in your hospital and you have an emergency department, you must determine whether or not an emergency condition exists. It doesn't matter. You can't ask them for an insurance card. You can't ask for anything. If they walk over that threshold and go through those doors, you have to determine whether an emergency medical condition exists. Sometimes that may require lab work, CT scan, different x-rays, other types of tests. So once they're there, they're ours. And no, you can't tell them, walk across the street to that urgent care. I would love to do that. As I remember, as I mentioned earlier, 90+% of those visits are urgent care visits or primary care visits, but they come to the emergency room and we have to treat them.
Are you doing marketing?
I'm sorry?
Are you doing some marketing?
We do a lot of marketing to try to tell individuals, you know, if you have a cold, if you have just a sprain, please go to an urgent care center. But I think most individuals, they just go where they're comfortable, and once they're there, they're ours, and we have to take care of them. Now, what we can do, once we've determined that there's no medical emergency that exists, at that point, we can refer them to a primary care doctor or an urgent care center. But at that point, we've done all the testing, because we're trying to now determine exactly what's going on with them, and that requires a lot of different testings and analysis of those tests. And it doesn't make sense at that point to try to send them to a lower level of care, because we've already done it. Yes, sir.
Just a very small question, because once again, I'm glad to know the residents who not in the hospital. But with the urgent care clinic we're supposed to be on, just to make sure I understand this. The ER, they don't accept payment from you right at the counter, is that correct?
We will accept any payment, we just can't ask for the payment before treatment.
I understand. So,
Yeah,
true, I'm sorry.
right.
So, someone who is not able to afford healthcare at the moment.
Right.
Has a better chance, I understand it goes to the debt bucket, but if they feel like they need help with their health issue, no matter what the health issue, because it is whatever going on with them,
Right,
they're going to the ER because they'll get that.
that's correct. And in the urgent care center, they do not have that same requirement. Okay, in urgent care center, many of them, they may have a sign on the desk that says you are responsible for $40 or $50, whatever that amount is. But in the emergency department, we can't even post it.
I just wanted to make a comment. So my name is Kimberly Rucker. I work for Thrive Alabama. We're a nonprofit health center here in town. And in the interim, certainly Medicaid expansion is an important issue for us as well. But in the interim, as we're waiting to see what our government will do with the issue, certainly it is to our benefit as a community to take some time and collaborate to try to help alleviate some of the pressure for the hospital, and that's been our goal. And I think there's been some kind of communication gap when it comes to the availability of options in our community. We are an organization that provides primary medical care and is able to provide primary medical care at significant discount, and we are required to take people regardless of their ability to pay. And so that is something that our community needs to know, that those organizations exist, and that not being able to afford going to the hospital and not having Medicaid expansion should not be a barrier to care for us in this community.
Is that a federally qualified health center?
We are an FQHC look-alike at this point.
Yeah, okay, got it.
This might actually be more of a question for the representatives. I'm curious, in some states where the governor just refused to take the Medicaid expansion, the people managed to have Medicaid expansion put on the ballot so that they could vote. I think it was, and even some red states, like I think Nebraska or Kansas recently, the citizens just voted to do it. So is there a process? Could we start petitions? How could we take it out of the hands of the governor, who clearly isn't qualified or able, or?
I would say that this particular governor has been looking at this for the last 12 months. And so this governor has not publicly stated that she's against expanding Medicaid. That's number one. Number two, certain states have different laws as it relates to constitutional amendments. Alabama is just one of the states where constitutional amendments have to go, for the entire state, have to go through the legislature. In other states, they're able to do constitutional amendments through petitions, but we're just not one of those states. And so if in fact you want to do a constitutional amendment in Alabama, unless it's just strictly geared toward Madison County, it has to go through the legislature and be voted on by at least 63 votes out of the 105 members of the legislature, 3/4.
Why does it take a constitutional amendment to expand Medicaid?
No, you mentioned bypassing the governor.
Right.
And you said that other states have done ballot initiative. A ballot initiative is a constitutional amendment. Yeah.
Anything in place or any proposals?
No proposals, meaning, so the only thing that's taking place right now, we've been in meetings for the last 3 weeks, off and on about this issue, and the meetings are starting to pick up again. And so we're trying to figure out a funding source for Medicaid. That's why you see the lottery up, a paper lottery, and there's also another bill regarding the lottery. And that will be, we're looking at that as a funding source to expand Medicaid, because right now we need between 145 and $65 million for the upfront costs, and then $25 million after that. And so we're looking at a funding source, and the lottery is one. There are some other things that we're exploring right now that deals with internet sales tax. We're looking at to see if in fact that is a way to come up with the upfront money with a sunset provision on it. And then there are two other options on the table, one of which I think many of the hospitals are not excited about, which is a managed care option. It's similar to the regional care, which was set up, and Huntsville Hospital was a participant of that particular model. And so the managed care is something that we're having conversations about, where we would impose a tax on those individuals that are participating in the managed care in the different regions, and it will get us where we need to be. It'll actually double the amount that's needed to do it, and then but it takes that structure some time to get done. And then there's someone talking about doing sports betting. The revenue from sports betting, using that to also support the general fund, which is the fund that the Medicaid funding will have to come from. And then the next topic that we're talking about, we'll see kind of how much revenue that particular conversation with the medical marijuana piece, to looking at ways that it'll generate revenue, and some of those funds go to the general fund, which, so we're looking at different things. We do have a proposal on the table for the governor to consider and sign off on, but we also have to work to make certain that we're working parallel to make certain that the funding source is there, and so we have those options on the table. And one of those bills will come up this week.
Hi.
Okay.
I think my question is for the legislators also. My name is Shonda Crutcher, and the fastest growing demographic in our nation is the 65 and older demographic. And with the Medicaid waiver and the community-based programs, what I've seen since back in about the early 2000s, that the funding, even though the legislation was there to help fund different environments like assisted living and home care, the funding was not there. And I went with Laura Hall back a few years ago to tour through several counties throughout the state, and what we learned from family caregivers is that people are dying waiting to get services in their home or to be able to supplement their income to go into an assisted living. And so even though each of us would want the goal of being able to age in a least restrictive environment in a way that best preserves our assets, we're giving people the option of either staying home and dying or going into a nursing home, sometimes when they're not even ready, and totally liquidating all of their assets and giving up legacy to move into the facilities to get the appropriate care. Is that a part of the conversation when it comes to Medicaid expansion? And if so, what headway is being made with that?
So no, we haven't had that conversation around Medicaid expansion. I will tell you that my focus has been solely on the 300,000 people that are underinsured, the working poor, individuals that are 100% to 138% above the federal poverty level, that work 30 hours a week, but still only making that amount of money. And so that's where the focus has been in the gap population. There is a lot that goes along with expansion, a lot of different benefits from mental health services and other things, and even all the way through corrections, healthcare through corrections. And so, no, we've not gotten into the details on that. For me, it's more about getting the expansion done and figuring out a way to get it done. I know that there are some benefits for the population that you described, but I'll be honest with you, I have not looked into that. But I want to make sure we get where we are, and then I think it'll free up money, even if it's not included. It'll also reduce some of the strain off the general fund budget for us to really look at those issues. And Representative Hall has shared that with me, and so thank you for coming, and certainly love to sit down and visit with you and talk further about it.
I love that. I just think that we all must, because that meal, we had this conversation today, I think the meal that we cook today, we're all going to be eating in 20, 30, 40 years. And most of us do not want to pack our bags and move into a 400 square foot space in a nursing home if we can avoid it. And there should be some conversations and resources put aside for that population.
I have a question. It's kind of anecdotal, but there's an observation first. When we need road repair, we pass that gas tax quick, fast, and in a hurry. Why does it take so long to fix what's wrong with our Medicaid expansion? Why don't we tax bad habits? That's what gets us in the hospital. We tax people who drive cars, for their gasoline, but why don't we tax bad habits? They get us in the hospital.
Yeah, I will say there has been conversation about taxing bad habits, whether that's soda or smoking and those types of things. It's just one of those sensitive issues that have not been able to get through our process, our elected process.
Your point is well taken, but let me say that those of you that sit in here in this room, the groundswell really has to come from you. No. That is not what you're doing. Right now we're talking and trying to get information, but the groundswell really comes from you, making sure that you've contacted that legislator that's on that committee, has a responsibility. That's work. That is not, Representative Daniels and I want to hear what you're saying, so when we go back to Montgomery tomorrow, we said last week, we didn't want this issue, Medicaid expansion, to become a side issue. We wanted to keep it front and center. That's why we're here tonight. And so your being here and your signing in says you're interested too. But beyond that, there is some extra push that comes. It may be in the form of a letter, maybe in the form of a telephone call, it may be in the form of an email, but legislators respond to what you say. We just have to keep it going. And so that is what happened when you talk about the habits, bad habits. When you bring up sodas, you would be amazed at what comes out of the woodworks when you start talking about taxing sodas. It is no joke. They come in there with water buckets. Now, I'm just saying you have to, but that pressure then has to come from you, the constituent, the person that uses it. Okay? Thank you.
I had a question
I'm going to
about,
respond to him real quick. If you're a fly on the wall in the meetings that we've been having the last couple of weeks, you will see that we are pressing the flesh on this issue. In fact, there are some things that are going to go down in flames if the conversations don't increase. And I've made that clear to the leadership last Thursday to be exact. I said, look, we talked about what we're going to do as it relates to Medicaid expansion. Prisons have taken over the conversation. We're trying to take the conversation back. And I've made it very clear that I'm tired of talking. I'm tired of task force. I'm tired of all these sidebar conversations. And so I've not been shy about where I am on this issue. And I will tell you there are going to be some good things that we're not going to be in support on, but we're going to talk strictly about expansion. Now, I've been promised this week we're going to have a sit down about expansion, and they're going to take, matter of fact, I'm supposed to submit a plan by Wednesday. And I'm going to submit that plan, and I'll provide back all of you that sign in. We'll communicate through email to let you know where we are in those conversations, and a list of the people that you need to apply the pressure to. And matter of fact, I may even give you their cell phone numbers.
We got a question here.
Sure.
a little while ago, Anthony, you said that the funding for the Medicaid expansion would be coming from the lottery bill. Which one? I mean, right now it sounds like Del Marsh is selling out the lottery to the Porch Creek Indians, and then there's another one that would give the money to the state.
Both of the lottery bills will generate the revenue needed to support this. One of the lottery bills that you're talking about is from Senator McClendon, who adds gaming to it, the video VRT machines. and the other one is a clean paper lottery bill. And so both of those bills generate the revenue needed to do this. One will probably generate more, the one that attaches gaming, but the one that's being pushed right now is the paper lottery bill. And so for me, I'm not making if either come up for a vote, I'm voting for it. And so I'm not going to really pick and choose. I'm just ready to get this conversation over with and get some action going, because we've done enough talking.
What are the House numbers on those bills and what committees, just so we'll know who to call?
I'll send them back. They're in the Senate. So
Okay.
they originated from the Senate, and so we'll send out an email with the actual number.
Okay, because we'll post it on the Indivisible page. We have 1,500 followers, and we'll ask them to make calls, this week. So, but we just need to know what bills and what senators need to be called about.
I'll post that bill number tonight on Facebook.
Okay, so you're going to post it on your page? Yep. All right, and we'll share it.
If nothing else, when you reach out to your elected officials, ask this one question: why does Alabama have to be last with health care? Why does Alabama have to be last with expansion? If nothing else, those two questions should prompt them to think differently about our state. And I've not been shy about asking those questions. We don't have to be last. We're smarter than that, and we can figure this out if we really wanted to. We've just got to get our political differences aside and do what you were sent to Congress to do, and that's to take care of the people.
I was just wondering if there's any data on how many people has passed away because they did not have access to Affordable Care Act per year. I know there's some statistics.
I'm sure there's some data out there. I don't have it, just right in front of me, but I'm sure there's some databases out there that can give us that data.
Gloria Batts. I want to revisit Shonda Crutcher's conversation. Maybe we could have more than one conversation going on in Montgomery at one time. And I'm aging in place, so I'm real concerned about the question that Shonda brought up, because many people don't want to even have, as she said, the nursing home as an option. They don't even want it on their plate. Why can't we have some, and Laura says Linda Coleman is working on some legislation, where I was black-headed when Linda started on that legislation. And in terms of the money following, you get my point. Yeah. You get my point. So the reality of it is, I am in too many of these healthcare facilities. I have not seen one that I would want to put an animal in without somebody in that family being with them almost around the clock. And that's just the reality of it. So we know a lot of it is, we know all of it is political. And it's in terms of trying to get good oversight in the nursing home facility. So if people are left only with that for themselves or a family member, that at least they could have a minimum of at least good health care. Some of these facilities are not even providing basic supplies to take care of the folks that are in these facilities. But the cost of having people there is constantly escalating. So legislators need to have more than one conversation going. At one time, we just need to do something about how conversations are had. And I know it always gets to the groundswell, starts with people and we come to these meetings. We have these conversations. But then I'm aging in place, and I hear everybody else around here aging in place. So let's have some real conversation where we can really, truly do something. The legislators can do something. I like Anthony's approach. We're going to stop talking about this stuff, because legislators stay in place, that they become now part of the problem. When you stay in place so long, you become part of the problem. You're not part of the solution. So let's have some real, more than one conversation going at one time. I applaud the fact that you're steadfast in the Medicaid expansion, Anthony. That's a good thing. But we got us kind of getting selfish, like David suggests. Let's kind of get selfish about folks our age your health declines to the point you're left in these facilities. You got no other choice but to be in nursing homes.
So your point is well taken, and I'll certainly take that back to Montgomery tomorrow morning, and we'll start having some conversations about that. Now, there are more than one conversation going on at a time.
We can come to Montgomery.
Well, I think that'll be appropriate for this group to come to Montgomery. One of the things I will say, just to talk about other issues that are going on, there are two marijuana decriminalization bills. That's one that has 2 ounces, and it will be retroactive, where we'll be really helping those that are incarcerated, and a lot of our family members. So there are a lot of bills that are moving through that we talked about at the first town hall meeting. So it does take time, but there are bills moving through the legislature to help people. Now, the assisted living situation, it's not been a nursing home. Nursing home, okay, we'll call it that. I've not had a lot of conversations around that. So this is the first time at any town hall meeting that I've had to where this issue has come up like this. And so I take the town hall meetings, I take the information from the town hall meetings, and I go back to Montgomery and have our team to start working on model legislation that have been done in other places to figure out where we are compared to other states, and using the best state as the baseline, and seeing where we can go from there. So your point is well taken. And the lottery bill is SB 220. That's Marshall. Go ahead. It's Senate Bill 220.
I know we don't call every senator, right? We have to get out of the city. If not, it would go to tourism or economic. Tourism and economics, we'll call everybody on that.
Whose lottery bill is this one?
Marsh.
That's the one that supports free drinking lottery.
That's what?
That's the one that supports free drinking.
I think that the news is telling us that, but it's I don't really see that being a Porch Creek Indian bill. But I will tell you that in the legislature, there are concessions made on certain things, because I don't see the overall legislature it's all about votes. I don't see the votes being there from some of our members that are more conservative as it relates to adding gaming to it. And so we want to be realistic here and not really sell your dream, and that's where I am, is the lottery bill that's a paper lottery is more likely to pass than the bill that has gaming to it, and that's the reality.
Next, need NAMI Huntsville, NAMI Alabama. I want to add a piece to the Medicaid expansion discussion from the mental health perspective. I see a lot of people who go into a hospital setting. They're in a crisis. They get stabilized and they're on Medicaid. And what happens to many of them is they don't want to lose their Medicaid benefits, and they're trapped in a place where they can't work. I like the Medicaid expansion bill because it gives those people who have stabilized after a mental health crisis the ability to work without losing their health insurance. And at least for me, meaningful work is just about the best mental health cure that there is. When there's something I can be involved in and engaged in, I stay healthy physically and mentally.
Totally agree. We have a Decatur West facility, and it's for psychiatric care, mental health, 64 beds, and we can't keep enough beds open for the number of individuals that's needed. I was visiting that facility a couple of weeks ago. I try to go by there every couple of weeks, and we had a 4-year-old at Decatur West and that individual has been there about 13 days now, and this is his 3rd cycle of visits. So this mental health is pretty serious. It hurt my heart that a 4-year-old was in our facility, but it's not uncommon for us to get 4-year-olds, 5-year-olds. I would say the youngest age that we average is about 5.5 to 6 years old.
So the lottery bill that you're working on in committee is to set up a funding stream. And then once that funding stream is set up, then the governor will earmark it for Medicaid when she pulls the trigger to expand Medicaid?
No, we'll add into the legislation